Thank you so much, Chair Westerman, for holding these hearings. Thank you to our Oklahoma representatives and everybody who has come. It's a wonderful showing, and it demonstrates, I think, our commitment to the bipartisan nature of tribal sovereignty and tribal self-determination. So I'm very grateful to everybody for being here today. And to our witnesses, I need to tell you, Oklahoma is one of those places that anybody who has worked in Indian country knows is where you come if you want to know more about Indian self-determination. I myself, when I helped set up 2 separate tribal health clinics, we looked to you, and you showed up, and you helped us, which is what you do to tribes across the country. You are always there with your assistance. And on a 50th anniversary, it is important that we both celebrate and reflect. It's celebration and reflection to see where do we need to go from here? What lessons can we learn? And you, in your written testimony, have pointed out a guidepost of what we can do. You have suggested that we increase and expand Indian self-determination to other agencies like the USDA, that we make sure that we cut bureaucracy and red tape, that we look at some of the burdens that tribes who might not have a lot of resources may face. And so I am very pleased to be here, the place where the Cherokee Nation was one of the first tribes to negotiate a 638 contract with the IHS and has the largest run health facility. Muskogee Creek's health system serves over 40,000 patients. And we know that when you exercise self-determination and build these health clinics, it not only serves your people, and you know best how to serve your own community, but it benefits everybody in the surrounding areas. It's the neighbors, it's the non-Indians who are also benefiting from your work. I do want to raise, however, a concern I have, which is 74 days into the Trump administration, we are not yet, and I hope it is a yet, and we will see better stuff later on, seeing a commitment to the spirit of Indian self-determination. On March 14th, Trump rescinded Executive Order 14112, which stated reforming federal funding and support for tribal nations to better embrace our trust responsibilities and promote the next era of tribal self-determination. That executive order spoke exactly about what we need to do, which is how do we improve efficiency, how do we cut red tape, how do we make sure that we look at cost sharing, which is a problem. When the president announced the rescission, he deemed it harmful. But what is harmful about promoting self-determination and self-governance? The federal government should make it easier for tribes to access and utilize funding, not harder. On March 6th, we also learned that the GSA planned to terminate leases for 12 IHS and 25 BIA field offices. In Oklahoma, you are so very lucky. I am such a fan of Chairman Tom Cole and his work and commitment to tribes. So he was able to get the leases in Oklahoma rescinded. But what about tribes across the country who also need to make sure that their BIA and IHS offices that serve these programs continue to be able to exist? I also am very concerned about the Medicaid cuts, because we know that Indian self-determination does not exist in a vacuum. That when I was helping set up those clinics and when you were setting up your own clinics, you were relying on third-party fundings. Everybody's shaking their head because it's simply true. But you're relying on those Medicaid dollars to come in so that you could increase services, because sadly, we underfund IHS. We've had hearings on that, and it breaks my heart every time we read the numbers of how every other agency for their health care gets paid so much more. And if you cut Medicaid funding, tribes might have to cut services, they might have to cut staff, and this is a major problem. So an $880 billion cut to Medicaid doesn't just hurt other communities, it hurts this amazing goal and promise of Indian self-determination. So I look forward to hearing more about that. But, you know, it is a celebration, it is a reflection, and I think it is a wonderful moment to be here at a place that is such a central locus of those great ideals that President Nixon put into action when he signed the Indian Self-Determination Education Act 50 years ago. And with that, I yield back, Mr. Chair.